That is the last bullet point. I cover your ass with everything I say in class. It's always in writing somewhere. And it's right there. Okay. So right there in the last bullet point, it says metabolic alkalosis. Now, on this page, for all of your little ostomy deals and your enemas, you know that's basic care and comfort. And on this page with all of that, just please remember left lateral Sims for everyone. Left lateral Sims. If you go down by enemas, it's in capital letters. All these GI things that have to do with ostomy and oscopy and colonoscopy and endoscopy and ostomy and whatever. Left lateral Sims for a lot of those things. Now, for the ileostomy, it's quite different than the colostomy. Your main thing to remember is the ileostomy is diarrhea in a bag. Everything that goes with diarrhea goes with the ileostomy. In other words, electrolyte replacement is electrolyte deficiency is very common. Skin irritation is very common. All of those things. Dehydration is very common. You know damn well you're not irrigating no diarrhea. Don't fucking irrigate this. Okay, so there you go. It's real. It's crazy. It's just ridiculous. It's diarrhea in a bag. Don't forget I told you that shit. Okay, very irritating to the skin. All right, next page. On page 10, everything on this page is what I do every day I work. Okay, so this is my department. So all these big old high-tech crazy ass procedures is my department. And this again, left lateral Sims. Okay, now our issue with all of these, every single thing on this page, except for the MRCRP, or the MRCP is just non-invasive, but everything else is very invasive. And the problem is what I put at the top. What I put at the top is your number one concern, no matter what kind of oscopy it is. And just listen to how many oscopies exist, okay? Just listen for one moment. Colonoscopy, ERCP, endoscopy, hysteroscopy, cystoscopy, your bronchoscopy, your laparoscopy, hysteroscopy. All of these oscopies have one thing in common: perforation. And that's at the top of that page. Number one risk is perforation. So any complaints of abdominal pain is an oh my God, see them first. Oh my God, see them first. And you see, I wrote that. Now there are other complications, but not as common. Aspiration. I know here at the Cleveland Clinic, we are monitoring our aspiration. We have a higher aspiration risk than some of our colleagues in the city. The infection is common sense. All right, so you got it. Now, quote me. Do you see where it says no driving? You better highlight that bad boy. No driving for any of these invasive procedures. So you'll get in an attitude with me because I ain't taking your ass back if I don't see your driver. So look at where it says the third bullet point, invasive, informed consent, no driving. Everybody got it? Okay, so let me tell you how that works in the real world. Okay, patient just popped up on the screen. Oh, let me see if they got some orders. Yep, I got orders. Let me go call them back. I go to get the patient, and when I go get the patient, they're sitting down in the waiting room. And I said, oh, no, don't come. I'm going to come to you. And I come to them, and they have their visitor with them or not. And this is how that goes. Oh, okay. So I'm Shelly. I'm going to be with you all day today, which won't be really long. We're not backed up. You're one of the first patients. You should be in and out within a half an hour. And I need your designated driver because you will be under the influence, boo. And so this person sitting here in a wheelchair. What the fuck is you driving? I mean, seriously. I mean, this is the kind of dumb shit you see. Okay, so this is your designated, really? This your designated driver. I'm gonna need you to come correct. This ain't it. Okay, we in a wheelchair. This is the kind of shit you see. The other day, you just sitting there with your little self, chilling like a villain. I come up to you. I say, hey, my name is Shelly. I'm going to be with you today, and we're going to get you in and out, get you to your little, you know, French fries and burger, whatever you want. And, baby, where your driver at? Park in the car, famous last words. Oh, for real? Holler back when they finish. And I'll leave. Go get another patient. That's the biggest lie in the world. They ain't parking a motherfucker. We know. They ain't parking a motherfucking car. They ain't even existing. So I come out there to get another patient. You still sitting there without that so-called parking the car person. I come out there to get my sixth patient. You still there without the so-called parking the car person because you thought I was boo-boo the fool. I ain't going down like that. This is a litigious area for nurses. You take that patient back and they go drive home and get in an accident and you have no name, no phone number, because we don't just ask, where's your driver? We take their fucking information. We so bad in some places, we take your driver's license and copy that bitch because we have seen you die right after this procedure because you decided to drive home and I just gave your punk ass 100 of fentanyl and 5 of Versed. IV push. You're never gonna make it to that house. Just crazy as hell. So this is a legal nightmare. You need to take me very seriously. Log in their information. Log it in. And we have to put it in the computer. I mean, we're not playing. We have to put that information in the computer. It's all up in Epic, everywhere. Now, your ride might be on some trash. And I do mean straight trash. They here in the seat. I take you back. Your scope is done. Motherfucker can't be found. What did this motherfucker tell me? I had to get my hair cut. You had to do what? Get your hair cut? Okay. All right. Cool. She ain't going home. How's she getting there? Where's she? You're supposed to have somebody with you after the procedures we do to you in my department. So you want some trash all the way around. Just sit your little ass down. You ain't going nowhere. You say you hungry. Better call that haircut nigga because you ain't getting nothing out of here. I mean, it's crazy. Okay, so y'all got it? All right, next page, babies. Yeah, this is highlight for your stuff. These are just procedures. You don't need to highlight anything on this page. But notice what I did for the babies. Do you see where it says Centesis? You don't want to ignore that I put 3 types. Amnio, thora, and para. Everyone see that? Your most important question with these is your positioning. The next page has definitely basic care and comfort. Turn to the next page on page 12. Genital urinary renal procedures are all basic care and comfort. Anything to do with a catheter or a condom is basic care and comfort. Please remember, freaks, that lambskin does not protect your little punk ass against HIV. You're welcome, darling. That was for free. Okay, sugar muffin. All right. Okay, so just remember that. That's important. Do you remember us talking earlier about dialysis patients? Put a big old star by dialysis and look what I told you to hold. When you read it, you're holding the digoxin, the aspirin, the multivitamin, and where it says hypertension meds, make sure you put diuretics because diuretics are given for hypertension, but some people may not realize that, so add diuretics. Hold that nitro. All of that's gonna make you get the #1 complication after dialysis, which is hypotension. You see, the #1 complication with dialysis is hypotension. Y'all see that in capital letters? Hypotension. It is an emergency if the thrill is gone. Because what were you supposed to do with the thrill? You feel a thrill and listen for a brewy, right? And when you listen for the brewy, you listen with the bell of your stethoscope. B for brewy, B for bell of the stethoscope, which is a smaller part of your stethoscope. But if the thrill is gone, it's a medical emergency. Okay? All right, turn. We are about to do pharmacology, so we're gonna skip all of this, of course. And I want you to turn the next page and you'll see wound and incision care. Do you see that? Wound and incision care on page 15. Yes, no, maybe? Yes. Okay. Now, let me just say, I don't know where to have my Jackson Pratt when to see somebody. But at least I got a devolve, an HVAC drain. Okay, listen to me. All of these closed wound drainage systems absolutely fit up here. And you will see it's right here. Okay, so you know you're gonna know this shit. So when you're talking about a Jackson Pratt or an HVAC, you must remember that this motherfucker can't work unless you smash it. And the Jackson Pratt, you gotta squeeze it. So I always tell you, this is your pancake. You put this cap back on just like you would for a Jackson Pratt. And it sucks the patient through this tube right here that is gonna go to the patient. So it's created a suction. Do not delegate this kind of shit if you don't know if they know what they're doing. Because when I was the first nurse tech ever hired in the history of Cleveland Clinic Hillcrest, they put me on the 5th floor, which was a surgical floor. Post-ops came, pre-ops came. And that floor has a drain in every human being, pretty much. And this bitch told me, did you empty my drains? This was an RN. And I'm like, no, I didn't know I had to empty drains. Well, you do. So I was not cocky project chick yet. I was nurse tech chick. And I knew that I was the first one hired. And they said, if I work out, they're gonna hire more. And if I work out and they hire more, I get to work in the #1 place that I wanna work in, which is labor and delivery and OB, which would increase my chances of getting in there when I'm a new grad. Because back then they didn't let new grads in that department. I had a plan. So instead of stomping this bitch in the parking lot, I decided to go head on and try to fuck with the drains. My dumb ass probably killed half the people in the unit. Because no, I did not know you supposed to squeeze it like a pancake. I just went like this, and this is so sad. I said, okay, empty all the drains. Then get this, even worse. I fucked with this motherfucker for a half an hour and still couldn't figure it out. I'm like, where does it empty at? Thank God I never thought of doing something stupid. I would have killed the patient. You don't empty a fucking chest tube? They said empty the drains. So every Jackson Pratt was fucked up. Every hemovac was fucked up. Thank you, Jesus, that you didn't let me fuck that up, because this would have truly killed the patient. You can't empty this, y'all. And I'm thanking God that they had the spiral tape. Remember you learned in school to put that spiral? Thank God for the nursing point. I would have took this shit. Cause another fucking pneumo. Oh my God. Yes, indeed. So it was a lesson in delegation. You can't delegate things you don't know for sure the person knows. So we had a little girl in our class, and my favorite thing is to get you jobs, right? So we don't just get you jobs as a nurse tech or PCNA, we get you jobs as the RN wherever you want within reason. So you need to know that the little girl who had the asthma attack, who used to sit here next to April, her name is Tiara. She's been offered, she's LPN, ICU, and she's been offered step down on G81. And she's been offered Metro and the Cleveland Clinic. She got options. In other words, this is what we do. So I get this little girl a job in H81 as a PCNA. I know that she's a newer baby, and they just told her, go do your thing. You got rooms 30 through whatever, and you usually have like 11 or 12 patients. And so I knew when I worked that day on the floor, and I was so excited I got to work with her, I knew this was a good chance to teach the baby some fun stuff. So I'm like, baby, go change the battery on the telly, because I have all my aides change the batteries at 7 a.m. That's how I do it. Change the battery in the telly for just 2 patients. And then I said, oh, CMU called like 4 hours later. The leads are off in room, whatever. I said, baby, can you go get the lead, put the leads back on? And I thought about it. I'm like, that's a new baby. I know that because I got her this job. That baby don't know nothing about no leads. So I said, no, do you know how? She's like, I don't know. I said, let's do it together. I'll show you, it's gonna be fun. So I take her in the room to show her how to put the leads on. And she's like, that wasn't even part of my training. Why didn't they teach me that? That's like, everybody keeps telling me put the leads back on. She didn't know how. So we did a good training. So really, really, really find out what your aide knows, okay? Your aide is gonna be your best friend, and you cannot treat them bad because you need them. All of the aides that I've ever worked with, they remember, and now they're nurses, most of them. And the ones that aren't nurses, they still remember. And I can go back to any place I ever worked and still see some of them, and we hug because I never mistreated them. You must remember not to be a snob and uppity bitch. You have to say, please, thank you, bring your little sweetheart a cookie or something. If you go on a trip, bring her a little treat, whatever you want, because your aides make or break you. I swear to God, you will have the worst day of your life as nurses if you don't make nice with your aides. They will take advantage of you at first, but there's a thin line between love and respect. And you have got to try your best to get along with these aides. Whatever I tell you to do with your first year on the job, remember what I taught you. For 6 straight months, shut the fuck up. Just keep your mouth shut. I don't care what's going on around you, unless death is ensuing, don't say nothing, because you're gonna be labeled a know-it-all. Shut the fuck up and always just say please and thank you. Don't yell at aides, don't say nothing mean. Help them, make it your purpose to go help them. Like, I'll give you an example. I was in the room, I said, oh, baby, I can help you with that. Are you sure? Ain't none of the other nurses helping me? I'm like, yeah, I love my patients too much to let them go through hell alone, so let's just do this. She came out and she was like, telling her friends, that nurse, she gonna help you. If you in the room, she will help you. One experience like that, and now you're known as a nurse who will help them. That's gonna take you forever through this unit. So just understand what it felt like to be an aide. Raise your hand if you were an aide before. Don't it suck when they're bitches? Yeah, and you know you hate them. We all know their names. I know their names. I got lucky though. The one that was the biggest bitch ever, she needed my class to pass NCLEX. She became an LPN to RN. It worked out because I would never hold a grudge. It worked all the fucking way out. I just took her money. It is what it is. I'm a business bitch at core. All right, so come on, babies, let's do it. Now, you got your little wound and incision care. You got your drains, you understand them. Something I think you don't know, because I didn't know, and I'm not even ashamed to say I didn't know, I just didn't know, is with staple and suture removal. I need you to really highlight the first bullet point where it says remove every other. Don't remove each one, skip one. Remove every other. Because if the wound is having dehiscence and evisceration, you just made it worse. So write down there about staple and suture removal, the first bullet point, you see the Q, remove every other staple or suture. Do you see that? And then you can take out the rest if it looks like it's nice and closed and there is no dehiscence and evisceration. Y'all see that, right? Remember, never lift the staple remover. Just squeeze it. You don't do this. You don't. You keep it, you slide it under, and you squeeze it. That is a big one, okay? Next page. This whole page is ortho. All of these are on your test. The ones you care most about, and of course you probably do best to look at the video, There's a video on all this shit anyway. But the one you really